Welcome to Sleep Better TV. I'm Scott Drake. My guest is Dr. David Rawson, TMJ Sleep Therapy Center of London, Ontario, Canada. Dr. Rawson, it's a pleasure. Welcome.
Thank you for having me.
So, Doctor, what is sleep apnea?
Sleep apnea is the condition where a person while they're asleep will stop breathing for at least 10 seconds. Quite often it's more like 30 or 40 seconds, but there's a total cessation of breathing for at least 10 seconds.
Can you talk about some of the short-term and long-term health risks associated with sleep apnea?
Not breathing during sleep for more than 10 seconds has long been associated with a lot of serious medical conditions like increased blood pressure, increased risk of heart attack, increased risk of stroke, and unfortunately sometimes folks even die in their sleep, and the predisposing factor may have been a long, undiagnosed and untreated period of severe sleep apnea. So obviously we don't want to ignore this. It is a very serious health concern.
So obstructive sleep apnea, where the airway is compromised during sleep, how do you diagnose that?
That's a difficult problem, and it falls into two categories. In my office, we collect as much anecdotal evidence as possible from the sleep partner. Sometimes the patient will tell us that they do wake up gasping and choking or have dreams of being choked or choking. But that's not scientific enough. The actual diagnosis for sleep apnea is for a patient to undergo a sleep study, usually in a medical facility, for a whole night, where they're actually watched and a lot of electrical leads are attached where a lot of measurements are taken, and there's a video recording of their sleep. So essentially, anecdotal evidence isn't enough for us. We need hard objective data collected in a sleep lab.
And doctor, can you explain CPAP treatment?
Dentists typically don't use a CPAP machine. CPAP by definition means continuous positive airway pressure, often referred to as the air mask. Some patients will have a mask or tubes in their nose strapped to their head, which they will wear for their whole night's sleep. That is a medical device usually prescribed from a sleep study in a medical environment. Dentists are aware of that problem, and we like to, if we can, alternate that treatment with a dental appliance called a dental sleep appliance, which is very much like a mouth guard or a series of appliances that patients would wear in their mouth, and the goal would be to be as effective as CPAP, so they wouldn't need to wear both at the same time.
Dr. Rawson, thank you.
Thank you for having me.
Once again, my guest has been Dr. David Rawson with the TMJ Sleep Therapy Center of London, Ontario, Canada, and you're watching Sleep Better TV.